All right, you guys, we are live. This is Keisha L. Hayes Hagens, and I am with my CMA students, and we are going to do a lesson about the anatomy of the heart and how the heart works. So, as we were getting on the actual stream, they had already created some hearts of their own, did some coloring to them and some labeling, and then they actually watched some videos about how to perform EKGs, and they have come in earlier in the week to be volunteers for one of our EKG students. So this is how the heart works, and this is the anatomy of the heart. So we're going to get started right now. So in this lesson, the objective is that by the end of this lesson, students will be able to explain the basic parts of the heart, describe how the blood flows through the heart, and connect heart function to medical assistant duties, such as when they do vital signs, EKGs, patient education, documentation, and recognizing emergencies. Okay, so um, we're going to learn about the heart. I do not want you to be intimidated by the anatomy because, believe it or not, I was. I'm telling you, the heart is, it seems complex. Okay, so we're going to break it down into simple terms, and I'm going to talk to you where it's simple, not to try to say that you can't understand complex things, but just to go through making it simple so that even a child can understand. So basically, the heart is a pump. Its job is to move blood through the body so that every organ, tissue, and cell can receive what? Oxygen and nutrients. Okay, very good. So everything we do in healthcare, it always connects back to circulation. Okay, so when you take a blood pressure, you check a pulse, you perform an EKG, you hear a patient say chest pain or document shortness of breath, you're dealing with the heart and circulation. So I want you to remember that. Okay, and a simple explanation of the heart is that the heart is a muscular organ. It's located in the chest, it's slightly toward the left side. Okay, it is about the size of a fist, and its main job is to pump blood. Okay, so I want you to think of the heart like a house with four rooms and doors. So, four rooms and doors. The rooms are called chambers, the doors are called valves. So remember, the rooms are called chambers, the doors are called valves. Okay? The valves open and close to keep blood moving in the right direction, just like somebody coming inside your house, opening the door. Okay? The valves, they open it up. Okay? So let's talk about the four rooms of the heart. We we have the top two rooms, those are called the atria. The bottom two rooms are called ventricles. So, top rooms, atria, bottom two rooms are called ventricles. The right atrium receives blood from the body, okay? Receives. The right ventricle pumps blood to the lungs, okay? Y'all got that? Okay. All right. The left atrium receives oxygen rich blood from the lungs. The left ventricle pumps oxygen rich blood to the entire body. So here's an easy way to remember it. The right side goes to where?
The lungs,
The right side goes to the lungs, the left side goes to the
body.
body.
Veins. No.
Right side goes to the lungs, left side goes to the body. Okay? And so then there's the valves. The heart has valves. They're like doors that open. They only open one way. I'll say it like that. They stop blood from flowing backward. So it's an issue when you have a leak in your valve, because when you have a leak in your valve, it's going both ways now, right? It's getting into places that it doesn't need to be. So they stop blood from flowing backward. So there are four main valves. You have your tricuspid, you have your pulmonary, your mitral, and your aortic. Okay, TPMA. Okay, TPMA. But to remember that, I think in nursing school, um, all patients take meds, aortic, um, pulmonary, tricuspid, and mitral. All patients take meds, APTM. Okay. But for today, I just want you to remember their purpose more than you just you memorizing their names the way that I did in school. Okay. So valves keep the blood moving forward. So just remember that they keep the blood moving forward. And when valves do not work correctly, patients may have heart murmurs, they may have shortness of breath, they may have fatigue, they may have swelling, or they may have chest discomfort. Okay, all those things may occur. And this is how the blood flows through the heart. So we're going to follow the blood through the heart as it goes where it needs to go. So blood comes back from the body low in oxygen. It enters the right atrium. Then it moves through the tricuspid valve into the right ventricle. The right ventricle pumps it through the pulmonary valve to the lungs. In the lungs, the blood picks up oxygen. Then that oxygen-rich blood, it comes back to the left atrium. It moves through the mitral valve into the left ventricle. Okay, it's a continual cycle. Excuse me. The left ventricle pumps it through the aortic valve into the aorta. The aorta sends blood to the entire body. So again, the simple version, you have body, right heart, lungs, left heart, body. Okay? Body, right heart, lungs, left heart, body. Did I get that? Okay? Yes, no.
Yes.
Okay.
Yes, ma'am.
So it could be difficult. It could be very difficult, but I want you all to repeat it with me. We're gonna get down there to where I want you to repeat it. Okay. So I want you to say, okay, everybody, I want you to say this with me. Body to right heart.
Body to right heart.
Body,
Body
right
to right
heart.
heart. Right heart to lungs.
Right heart
Right
to
heart
lungs.
Lungs to left heart.
Lungs to left
to
heart.
left heart.
Left heart to body.
Left heart to body.
Let's say it again. Body to right heart.
Body
Body
to
to
right
right heart.
heart.
Right heart to lungs. Right heart to hello.
Right heart to sorry. Right heart to lungs.
What's going on? Somebody's echoing. It's not me.
I think when we all have our
It,
mics on, then it kind of
it
echoes.
echoes.
Oh, okay. Well,
Yes.
I'm gonna go one at a time. Christina, start with you. Body to right heart.
Body to right heart.
Right heart to lungs.
Right heart to lungs.
Lungs to left heart.
Lungs to left heart.
Left heart to body.
Left heart to body.
So body to the right
Body to the
heart.
right.
Right heart then goes to the lungs.
Mm.
Lungs to the left heart to the body. Okay.
Yes.
Jeremiah. Body to right heart.
Body to right heart.
Right heart to lungs.
Right heart to lungs.
Lungs to left.
Lungs to left heart.
Left heart to body.
Left heart to body.
It's Jeremiah. Are you recording yourself or you on another device?
I think it. Yeah. Let me fix my mic. I'm sorry.
Okay. All right. Harley. I think you already said it, right, Harley?
Mm-hmm. Body
Okay.
to right heart to lung to the left heart to the body.
That's right. Okay. K. Body to right heart.
Body to right heart,
Right heart to lungs.
right heart to lung,
Lungs to left heart.
lung to left heart,
And left heart to body.
left heart to body.
All right. So which side of the heart? Okay. Now that we've repeated that, and you have the body to the right heart to lungs, lungs to the left heart to the body. Now I want to ask you these questions to see, what you remember. All right. So which side of the heart sends blood to the lungs?
The right,
The right side. Which side sends blood to the body?
the left,
The left side. All right. Got it?
Yes, ma'am.
Okay. So the heart beats because of electricity. The heart has its own electrical system. And you can see the electrical activity of the heart by doing what? Performing a what?
Is it a EKG?
EKG. The one that you left us with the other day, Jim. I had to get you on that.
It was after the guy left. I just left because I didn't want to see
Yeah, we didn't want you to. Yeah, we didn't want you to be flattered so much. We had to let you go. I understand. Oh God. But the electrical signal starts in the SA node. The SA node is known as the natural pacemaker of the heart. The natural pacemaker of the heart. The signal travels through the heart and tells the heart muscle when to squeeze. Okay? When to squeeze. When the heart squeezes, that is called what? When it's squeezing, what is it doing?
contracting,
Contracting. Okay? So when the heart relaxes and fills with blood, that is called relaxation. So there's contraction and there's relaxation. This is important because an EKG records the electrical activity of the heart. And as medical assistants, we all know, because we talked about this earlier in the week, you may perform EKGs, and you need to understand that the EKG is not looking at blood flow directly. It is looking at electrical activity. Okay? Now, we're going to connect that to the pulse. When the heart pumps blood, when it pumps blood out, we feel that pressure in the arteries as a pulse. Okay? When you check a radial pulse, where's your radial pulse located at? Your radial pulse.
your wrist,
At the wrist, okay, right side of the thumb at the wrist. You do not use your thumb to feel it because it has a pulse in it, okay? But when you check a radial pulse at the wrist, you are feeling the heart pumping blood through the arteries, okay? A normal adult pulse is usually 60 to 100 beats per minute. If it's below 60, they normally say it's bradycardia. I remember it because remember that show called The Brady Bunch? I thought that those were some slow people on that show. So when I hear bradycardia, I think of slow. If it's over 100, we start saying that it's tachycardia. Okay, but the normal is 60 to 100 beats. If the pulse is too fast, too slow, too weak, if it's irregular or hard to find, that is something we report. Okay. And you're going to be noticing that. All right. So now we're going to connect it to blood pressure. Blood pressure measures the force of blood pushing against the walls of the arteries. The top number is known as what? I want to see if y'all know this. We haven't talked much about the vital signs yet, because that's in a lot of our procedures that we're going to be performing coming up soon. But the top number of a blood pressure is systolic. The bottom number is diastolic, okay? But systolic, that is when the heart is squeezing, that contraction. That's when the heart is squeezing. The bottom number is diastolic. That's when the heart is relaxing. So just imagine when you take blood pressure, you're measuring how hard the heart and the blood vessels are working. So just think of somebody who is getting their blood pressure taken and their bottom number is extremely high. Then it's an issue if top or bottom is high, but if the bottom is high, and that's when your heart is supposed to be relaxing, that's kind of troubling, okay? So now we're going to connect this to oxygen. The heart and the lungs, they work together. The heart pumps blood to the lungs to pick up oxygen. The lungs oxygenate the blood, and then the heart sends that oxygen-rich blood to the body. So we need things to work together the way they need to work together, because when it doesn't, it messes up the flow of what we need, okay? So this is why shortness of breath, chest pain, low oxygen, dizziness, or blue lips, cyanosis, can be very serious, okay? It may mean the heart, lungs, or circulation are not working properly, okay? And what you need to know as medical assistants, that's why it's very important for us to have gone through this. You may not diagnose heart problems, but you are often the first person to notice when something is wrong. So you got to take it seriously and you got to report it. Okay. So you will take vital signs. So all the things that we just went over, you will do. You will even ask patients about their symptoms. You may perform EKGs. You will document accurately. So all this stuff is important. You may assist during emergencies. You may teach patients about diet, exercise, medications, and follow-up care. That's why your role is so important. And you must know when to report abnormal findings immediately, okay? And some of the symptoms that you're going to need to report immediately, okay? If a patient complains of chest pain, or they have pressure, or shortness of breath, if they are sweating, if they become nauseated, if they have pain going down the arm, jaw pain, they feel dizzy, or they feel like they may pass out, you cannot ignore that. You do not say, oh, it's probably nothing. You report it immediately to the provider or the nurse or whoever. You do not want to be the person to have known something and do not report it. So your job is not to diagnose, but your job is to recognize, it is to respond, it is to document, and it is to report. Hey, I see your baby. All right, everybody wants to learn about the heart, even children too, even little babies. So think of the heart like a delivery system, okay? We're going to put it all together. Think of the heart like a delivery system. The blood is the delivery truck, okay? Oxygen is the package. The lungs load the package, okay? The lungs load the package. The heart drives the package through the body. The blood vessels are the roads, okay? If the pump is weak, the delivery is poor. If the roads are blocked, the delivery is delayed. Come on, somebody. We having church up in here. Yes. I will talk about God and everything, okay? Even in the heart system. If the electricity is off, the pump may beat irregularly, okay? All right. So, you know, I mean, I'm not the expert on anything, but, you know, I make sure I study so that I can teach y'all the things that I feel like I struggled with the most when I was in school, and this is one of them. But once again, I want you to think of that heart like the delivery system, the blood being the delivery truck. Oxygen is on that truck being delivered. The lungs are the one that loaded the package, the oxygen. Okay. The heart drives the package through the body. The blood vessels are the road. If the pump is weak, the delivery is poor. If the roads are blocked, the delivery is delayed. If the electricity is off, the pump may beat irregularly. Okay. So a quick review. A few questions. All right. What is the main job of the heart? It's very simple.
Pumping blood.
To pump blood. Pump, 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 pump it up. P-U-M-P, pump it up. Y'all heard that in school, I know, at every football and basketball game. Okay? P-U-M-P, pump it up. To pump blood. And I bet if you get that question on the test, you're going to remember me saying what I just said, and you're going to get it right. How many chambers does the heart have?
4.
4. And what are the top chambers called? What? Atria. And what are the bottom chambers called?
Ventricles.
Ventricles. That's right. Okay, so which side of the heart sends blood to the lungs, Jeremiah?
Think to the right.
Right. Which side sends blood to the body, KK? Is Kay still with us? Which side sends blood to the body, Kay? Somebody help her out.
The left side.
Left side.
Right.
The left side, okay. What do valves do? What do valves do, y'all? They keep the blood
Keep the
moving
blood
where?
moving forward.
Moving forward, okay. And what does an EKG measure?
The electricity. in your heart.
Electrical activity, yes, of the heart. Very good. So what does your pulse tell us?
Is it our heartbeat per? I don't know what it's called. Yeah, heartbeats per minute.
Yeah, it's how many times the heart beats per minute, and it tells us about the rhythm and the strength of it. Very good. So what should you do if a patient reports chest pain?
Report it.
Report it immediately. Report it immediately. Okay. So very good. So what? That wasn't so bad, was it?
No, this is actually a lot better than reading it in a book.
So I just want y'all to know that the heart is not just something you memorize for a test. Okay. You will use this every day as a medical assistant. Every pulse, blood pressure, EKG, oxygen level, and patient complaint connects back to how the heart is working. It's going to be every day. So when you understand the heart, you become safer, you become more confident, and you become more valuable in the clinical setting. Okay? So just remember, you don't diagnose though. but you do observe, you do report, you do document, and you do respond. Okay? All right? Yay! Awesome.